Good morning, everyone, and welcome to the Global Health Coffee Break. My name is Tatiana Mansurova, and I work as a project coordinator on the Global Health Initiative at the Broad Institute of MIT and Harvard. Global Health Coffee Breaks are organized by the Broad Global Health Initiative with the aim of spotlighting the impact of COVID-19 around the world. A few weeks ago, we heard from Diane Worth of the WHO on the coronavirus's effects on the treatment of malaria in Africa, and we have a number of exciting talks in the works featuring other parts of the world. We welcome suggestions for future talks, and you can reach us at global@broadinstitute.org. Thank you all so much for tuning in bright and early. We have some great guests lined up for you today, joining us to share their experience of COVID-19. And we're so grateful for their time, especially since it's getting late in their part of the world. Our first guest joining us today from China is Dr. Xiancang Ma, who is a psychiatrist and PI on large genetics of schizophrenia study in conjunction with the Stanley Center for Psychiatric Research at the Broad. Dr. Ma led his team to Wuhan, where he treated patients for 2 months and is leading the return to work in his institution. Second guest is Dr. Jae Jung, who's a psychiatrist and epidemiologist from South Korea and a visiting scientist at the Harvard Xi'an School of Public Health. She's leading mental health research and setting up COVID-19 guidelines at her institution in Seoul. Facilitating today's session, we have Dr. Hailiang Huang, who's a statistical geneticist at the Stanley Center and Mass General Hospital. And also with us today is Alice Zhang, a project manager at the Stanley Center, primarily supporting the Asia initiatives on severe mental illness. And Alice has graciously agreed to help out with translation. Working across multiple languages is a part of the global health experience and one of the things that make our jobs interesting. And we thank Alice for her help in bridging the gap and allowing us to share knowledge and expand our perspectives beyond language barriers. And just to orient you with where things are in the countries that we're spotlighting today, we have some statistics here from Johns Hopkins. This is the situation in China from January 22nd to May 19th. Here is where things are in South Korea. And for comparison, this is where we are in the United States today, across all states and territories. Thank you again to our panelists for being here today. And without further ado, I'm going to turn it over to Dr. Huang.
Great. Good morning, everyone. And thanks for joining the Global Health Coffee Break. So without further ado, I'm just going to start asking questions. So Dr. Ma and Dr. Song, I wonder if we could start by having you sharing with our audience what have you been doing before the outbreak and what have you been doing during the outbreak? What's your role in the outbreak? Could we start with a question like that? So maybe Dr. Ma, you want to get started first?
Okay. Good morning, everyone. I'm very glad to meet you at this coffee break. I will speak with Chinese, and Alice will translate for everyone. Thank you. Alice, 你好。
王老师，您说。
好，您的声音可能比较小，对。那么好的。那么我在武汉遇到个人最困难的事情，就是我感觉到，当时形势不明确，那么作为我个人来说，也有对这一种疾病、对这一种传染性疾病的这一种恐惧，所以说我们首要的任务，我当时就是克服了这一种恐惧的心理，来到了武汉。当然到武汉以后，仍然有这一种恐惧的心理。
So personally, I had some challenge. I went to Wuhan. As I went to Wuhan, as an individual, Wuhan was in a very critical situation. I was very scared, not only at the really beginning, but also I was like even more scared when I was in Wuhan.
好的，那么在工作中间遇到的困难我们主要是第一个就是，因为我们是陕西省医疗队。它是由41家单位的41家医院的医生临时1天时间组建起来的，所以我们之间是不认识的。 那么如何快速的投入到我们的救治工作，是我遇到的工作的第一个困难。第二个呢，就是当时是我们的防护物资在紧急情况下还是不充足的。那么所以说第二个的困难就是如何保护好每一个医生不被感染，是我遇到的第二个的困难。第三个困难就是因为我到湖北跟陕西还有很大的距离，生活习惯也是不一样的，所以到武汉以后，大量的队员他们的生活感觉到不习惯，所以这是我遇到工作的第三个困难，可能主要就是这些困难。
In work, I need to, within like 40 days, I need to pull out people that I have never worked with for other hospitals to go to Wuhan together. The biggest challenge is how to unite everyone to form a team that can work effectively to fight the virus, with the condition that they were really short of PPE. And the third is how to make sure the team that I was leading, make sure they are safe, they were not affected by the virus. And then also like life-wise, when we got there, the diet difference are pretty huge between Wuhan and then Xi'an.
Great. So, Dr. Ma, we really applaud your service to the patient and to the country during the outbreak. We might come back with additional questions if time allows, but for now, let's turn to Dr. Song. So, I also understand you have performed such as mental health survey during the outbreak and did many surveys in Korea to fight against this break. So, could you tell us a little bit about your experience?
Sure. So I want to share some of my slides because I think watching actual pictures would help about this, how to understand this. Just for a second. So could you see my slides here? So yes. I heard from the Jae Jung that maybe first I have to introduce myself again, that I was introduced as a psychiatrist, but I'm not a psychiatrist. I'm a preventive medicine specialist doctor in Korea who have worked with the psychiatric epidemiology. So I would rather say I'm a psychiatric epidemiologist. And so for it's coffee break right now, and I know it's you guys are awake very early in this morning to have this coffee break. But I just want to say something about the coffee break in Korea right now. If you just go to the Starbucks, then the first sign you can see is about the sign that are noticing that it is a safe place and everybody is wearing face masks in Starbucks too. So so for the opening things, and just to show you my normal job or my usual job in Korea was do research and teach epidemiology, of course. I'm not a clinician, but I do most of the research most of the times, and especially as a psychiatric epidemiologist, I normally do research on depression, PTSD, anxiety, and I work for standardization of the national mental health measurements. And my latest grants were to evaluate the association between trauma and PTSD on the cognitive function and to explore the biological characteristics of the psychological resilience. But at the corona outbreak, everything changed. So I have to tell you that there are only 3 epidemiologists in my university as a faculty members. And nationally, we have about 70 faculty epidemiologists in South Korea. So it means that most of the epidemiologists are working, they usually work for chronic diseases such as cardiovascular or cancer diseases. But in this kind of situation, everybody have to work for infectious diseases epidemiology instead of their own field. And we have to provide evidence for this novel coronavirus, even though we were not infectious disease specialists. So I have to make plans and for my university and also for the hospital, which I had both of the affiliations. And you're seeing the picture of the Severus Hospital, and it has about 3,300 beds. And also the campus in Yonsei, Yonsei University has about 29,000 students here. So I have to work for both of the institutions. And for the hospital, if you see here, I have to make the plans about the making secure entrance and not to mix the inpatient and the potential COVID-19 cases. So we just built this kind of entrance systems to check if they have any kind of symptoms or like the histories of the potential COVID-19 history, and to do some triage work to enter this kind of entrance. And also, it was important to do the high quality epidemiological survey and link the data between the internal institutions' epidemiological survey data to the National Infectious Disease Data Control System. Since I work as a disease detective in the MERS outbreak in 2015, and then in 2015, South Korea also experienced this kind of infectious disease outbreak. And I tried to make the similar reporting and survey system of the COVID-19 outbreak inside hospital to that of the national ones. And also my fellows and residents epidemiologists did the epidemiological survey when the COVID-19 case was confirmed inside hospital. So actually, in this Severance hospital, we had confirmed cases of coronavirus. And they served as a bridge, as a reporting hospital records and the National Disease Detective dispatch. However, if you see the campus, the bigger problem rose from the university campuses. Especially, we had an international campus, which are the students of this campus are most from abroad, and they don't have any other residents other than dormitory, so they all have to stay in dormitory. But this, worries the professors and the school. So a lot of students still wanted to enter dormitory since the semester was begun in March in Korea, and we have to make control and prevention plans. So for example, with my colleagues, we made a mobile application to monitor the disease status and also their mental health status.
Great. Wow. Thank you for this very nice introduction. So next, I wonder if we can talk a little bit about yourself during the outbreak. What do you think is the most challenging thing for you personally and for your family? So maybe this time we can start from you, Dr. Sung.
Okay, so so could you still see my slides, or do I have to?
No, not anymore.
I'll do it again. Okay, yes. So yes, for my challenge, my workload increased, rapidly from the COVID-19 outbreak, and since most of my institution needed someone to make plans, do the statistics and make guidelines, and also I continued my survey during this period too. And I was working for the mental health indexes in this period, so I was very anxious if I would lose the golden time. Like I would fail to capture the right anxiousness or kind of depressions or that kind of things. And as all of my classes were turned to the online settings, like as you see here, I have to adjust to the new technology. And at the beginning, there were so many technological problems while I was doing my classes, and I was totally burnt out. So that was kind of my professional challenges. And actually also my personal challenge, I think it was really huge too. You see, this is my daughter. She's second grade at her elementary school, and she has to do the online classes too. So she could not, because in Korea, the semester started in March, and people were waiting for the March, but we couldn't open the school, so she has to do the online class. And for her, she has to learn about the Zoom. She has to learn about how to type, and those all kind of online things she has to learn in the second grade of elementary school. And also, someone had to stay with her during her classes, and it was so frustrating that every parent and also teacher is watching me through the Zoom and my kid's room too. So it was really frustrating. And because my husband is working too, so it was hard to decide whom to stay home and do the online class together. We had a nanny, but she couldn't come to my house since people were afraid of using public transportation. Like unlike US, most of the people in Korea use public transportation, but there were so many limits, and people have fear about the COVID-19 this infection through this public transportation. Now, if you see here, they are cleaning really well, and they're really paying attention to this. And everybody should wear face masks to hop onto the public transportation. But at that time point, it was impossible. So my nanny can't come home too, and eventually I have to get some help from others. And also in weekends, we could not go anywhere and just stay home. So personally, I used to relieve my stress in art museums, but it was impossible too. And I felt that I lost so many ways to deal with my own stress too. All I could do was watching TV, and most of the shows broadcasted the shows without ad-placed audiences. So it's all show without audiences. And also, even I cannot go to church because online service was open. And since there was a big outbreak related to church at the beginning of this outbreak in Korea, so some people were afraid to tell that they go to church. So there was a kind of stigma. And my daughter also participated on online service for kids, and I thought that they're watching just Sesame Street instead of doing the online service. Okay.
Well, thank you. I'm sure many of our audience share the same personal challenges as well. So let's now turn to Dr. Ma. Dr. Ma, would you care to share a few of your personal and family challenges? 是您个人和家庭遇到的困难。
就是我个人的困难是吧？我刚才声音不太清楚。
对，就是您个人在这个疫情期间遇到的困难。刚刚这个老师他讲了，就是他自己，比如说在家庭啊、孩子没人看啊这些困难，就是说您个人。
好的，因为我这一次的整个抗疫过程中间，基本上没有在家里边待，因为我是带着我们陕西的医疗队去支援湖北省的武汉市，所以说我个人的另外的一个困难就是对家里边人的担心，以及家里边人对我的担心，因为我们基本上是大概3个月的时间，都是在跟家里边人都分别没有在一起的，这是第一个困难。第二个困难呢，就是还是我本人也在开始的时候对这个疫情也有恐惧的这种心理。
So the biggest the difficulty time that for Dr. Ma is that because he was called by the country to support and help Wuhan. So at that time that he really doesn't have time to see his family. So the worrisome from him to the families, and also the families about him, was killing him. And then for that part, he has separated with the family for 3 months, and it was like really big challenge.
Thank you, Dr. Ma. Thank you, Alice. So with the consideration of time, let's move on to the next question, which is something we really want to learn from you. That is the reopening, establishing the new normal. So the question 1 would be, has your institution reopened? And if so, what measures has you been taken? And if you are planning, what is the plan? What consideration goes to the plan? So maybe this time we can start with Dr. Ma. 马老师，我们在说那个重新开放的时候有哪些考虑，哪些措施
？OK。那么在武汉在这几个月的时间里边，我们也总结出来的一些好的一些措施或者是一些经验。因为这一个病呢，它是一个呼吸道系统的传染的一个疾病，所以说我们总结出来大概有这样几个经验。如果能做到这样几点，就能够基本上能够避免被感染。第一个就是在人和人的交往过程中间，一定要保持适度的社交距离。这个距离大概就是1.5米左右，这是第一个。第二个呢，就是在这一次抗疫过程中间，口罩是特别重要的，所以说还是要鼓励或者说要求，在疫情没有消退之前，我们每个人都要戴口罩，这是一个科学的一个问题。第三个就是手卫生也特别的关键，我们在回到家里边以后，或者说进到实验室，从外面进来等等，都应该及时的洗手。进行手卫生。第四个，我们在这一次发现特别重要的就是我们在密闭的环境中间，比如说屋子里边，应该每天 要定时，比如说每半天要开窗户，然后进行通风啊。所以说在这次武汉过程中间，我们就总结出来这4个经验，我觉得是对每个人来说都是非常重要的。
So as having asked, Dr. Ma said that now his hospital and labs are all open. Since it's a respiratory disease, we need to keep doing the 4 things that which you probably saw on the news or every day. First, the social distancing. Individuals should be 6 feet apart. And second, wear masks unless you are by yourselves. And third, wash hands regularly. When you come home and you are entering the lab, make sure you wash hands. And then the fourth one is also very important, that they found out that in Wuhan, the ventilation. So open windows if you have it for every day for at least 30 minutes a day. And that's as long as we do the 4 things that I mentioned above, I think we should be very good in reopening.
Great. So if I may, I just want to ask one more question for Dr. Ma. So you work in a hospital setting. You have patients visiting every day. You have a lot of doctors in a closed hospital building. So what measures have you been taking to prevent a outbreak again in the hospital? 所以马老师，我在问医院采取有什么具体措施保障病人和医生的这个安全有哪一些？
那个黄老师，这个声音不太清楚，我没有太听清楚。
Sorry, the voice quality is not good. So I'll just rephrase my question in Chinese for Dr. Ma again. 所以马老师，我刚刚问的是那个医院采取了什么措施来保证这个病人和医生的安全？在具体就是因为流量很大嘛，病人的流量很大，医院采取了什么样的措施？
好的。那么医院里边主要是还是要要求每个医生都要严格的防护，因为我们是待在这个定点确诊的患者的医院，所以说每个医生在工作期间，在接触病人的时候，都要要求达到我们所说的3级防护，这是最重要的。那么对于病人的安全来说，我们把病人分成不同的层次。轻症的患者，那么就在轻症的病房；那么重症的患者就在重症的危重的病房。所以他们的医生的配置以及他们的治疗的措施也是有区别的，这样就保证医护人员也得到了保护，那么我们的患者也得到了根据他们的情况得到了不同的治疗。
So the first one that Dr. Ma mentioned is that all the doctors, they do as much protection as possible because the hospitals that he's in that has a lot of cases in different circumstances. Some patients are in a mild situation, but some are in a critical situation. And the hospital, they categorize those patients into based on their symptoms, and then they put them in different sections of the hospital. Patients to make sure patients are well protected, so as well as doctors.
Great. So now let's turn the question to Dr. Sang. So Dr. Sang, would you care to share some thoughts regarding the reopening, any either planning or the real measure you have been taking to reopen your institution?
Excuse me, but actually, sorry, but I have the technical issues right now, so I cannot share the slides because I think I'm having some kind of problems. But I just want to say, actually, we never closed our institutions. From my campus and my hospital, they always were ongoing, even though the campus just remained on to the online lectures and online meetings. But we never closed our institutions, and but we kept the semester ongoing. And if the paper examination is needed, like the insight, people have to gather all time together to do the examination, then we need a bigger space. So usually we just need one auditorium to do all the paper examination, but these days we have 4 auditoriums, and to make the students to make some distances between their examinations, to keep distance of 2 meters, which is equivalent to like 6.5 feet. which we believe it will be okay for the transmission. And all the works inside hospital was never shut down. However, we have to submit our self-monitoring checklist every week and have to pass the entrance with all the thermal cameras and show our IDs to get the safety sticker. So if you guys see here, I have a safety sticker with me, and it's said that it's for Friday only. So if you're entering the hospital tomorrow, then you have to get a new sticker said it's Friday. So and like these kind of procedures we've done to do our institutions not reopening, but just maintain the safety.
Got it. Thank you. Thank you very much for sharing your thoughts. So we received many questions from the audience. I'll just start picking the questions. The question number one is from Sinead Chapman at the Stanley Center. The question is, when you return to work, when people return to work in your institution, do you allow them to all return to work at the same time, or do you organize them in shifts? You know, one group of people at one time. I'll also rephrase this question in Chinese. So 马老师，这个问题是这个开始恢复工作的时候，我们是全部的老师，所有的医生一起同时恢复上班，还是会分批次、分那个班次？比如说一部分老师在一个时间点，另外一部分老师在另外一个时间点。
这是一个非常好的，也是一个非常重要的一个问题。那么我们在恢复工作的时候，没有要求所有的老师或者我们的工作人员全部回到我们的工作的场所，而是要分批次错峰。比如说一半的人上午，一半的人下午，或者说今天是这一部分人，明天是另外一部分人。因为在这个工作，无论是工作还是就餐等等，我们都是希望能够保持一定的这样一种距离。所以我觉得我的建议也就是我们在开始恢复工作的时候，也应该避免人员过分的聚集或者人员过分的密集。
Yes, not all the doctors went back to work at the same time. They do shifts. Some doctors working like say Monday as Dr. Jung's institution do. To make sure that the hospital is not crowded by even for the doctors, it's very important to keep in mind that physical distancing is very important.
Dr. Song, do you have, well, since your institution hasn't been closed, so I guess this question doesn't apply to you. Oh, hey, Sinead, do you have additional question?
Oh, no, I just wanted to say thanks for the answer. Just in terms of like comparing it to the broad, obviously is sort of what I'm thinking about, and how we consider having everybody back on site, and you know how that has worked for both of your institutions. Thanks.
Totally. So Dr. Song, we also have a question that is specifically targeting again to you. The question is, as a scholar who spent a lot of time in US and Korea, what is your thought regarding the differences between US and South Korea in terms of culture and political willingness to take up invasive interventions to fight against this COVID?
So I have to apologize again because the sound is not good, so I may not catch everything you said, but I understand that the major question was to compare the different culture between South Korea and the United States about the infectious disease control in the general population, right? Am I right?
Yeah. Oh well, especially regarding the intervention, how people are, taking the intervention into consideration.
So intervention means that the protective. Could you just elaborate about the intervention?
For example, I guess it's the following the government advisory regarding wearing the mask, regarding stay at home, how people are doing that.
Well, because I'm not at the time point of the US, so I don't know about the US situation. So I have to kind of estimate about thinking about what my friends will do about this situation. But in Korea, I mean, Korean people actually experienced this kind of things before too. So I think they're kind of emotionally herd immunized about this situation and the government's actions. People understand, and people, I mean, like Korea has a sort of a strong national authority. So people listen to what government says, and it's a small country, so people also take very heavy weight on the government's mentions, and they want to do follow about the situation. However, some people think about their own thoughts and rethink about why the government giving us our this kind of note to us. Is this really possible? Is this real? And then they also think about and also debate about the truthfulness about the government's mentions. However, at the beginning, the people were really well organized, and they really tried to do so. They tried to follow the government's notes and government's guidelines. And also, they have kind of a I just want to show you this kind of a picture here also. So they made their own campaigns like this too. It is called the Thanks to the Medical Staffs campaign, and which means that we, because of the medical staff and also because of the national authorities working and the CDCs, we saved our lives here. So the people want to provide their gratitude to the authorities. And I think that's the difference. I mean, that's kind of a very national feelings, how they feel about this kind of government mentions. Compared to US, I think that, I mean, US is more like the individual weighted culture. Like people can say anything, like people can express their thoughts in this kind of period. But in Korea, I mean, there's sort of people thinking that if I may say this out loud, then it may hurt kind of the public or like the group feelings. So it can be some different point of view to the government intervention.
Got it. Great. So our next question will be from Kirsten. Kirsten, I think you are on mute. Oops. Maybe we could move to the next one when Kirsten will probably join in. So the next have hospitals, other health institutions in China and South Korea made efforts to address the mental health of employees who are working at the COVID-19 intervention. For example, making sure they're not overworked, they're not burned out, they're not suffering from trauma, PTSD from seeing dying patients. So I'll rephrase the question in Chinese again. 所以马老师，这个问题是我们医院有没有采取措施防止自己的医生和工作人员被这个疫情导致有精神的问题，比如说被有重大创伤、创伤后应激症，看到大量的病人死亡，有产生不适或者是过于的辛苦。So any of you who are ready?
Yeah, sorry, Haliang, I want to keep follow up on this question. Is this in Wuhan or in the current hospital? This question is.
I guess either will be fine. I guess any experience you can share that will be very helpful.
马老师，
好的，这也是一个非常好的一个问题。那么我们医院里边从一开始就特别的关注我们医护人员的心理健康和精神方面的一些问题，所以我们在开始的时候就专门配备了心理科的医生和精神科的医生。那么一个是通过电话的这一种咨询，第二个呢就是通过视频等等进行一些咨询。特别是我们在这一次做了很多的宣传和科普性的工作，就是我们的医生或者说我们的包括我们的病人，特别是我们主要先关注医生，那么他们可能会出现哪些问题，我们应该采取哪些措施，提前就给这些一线的医生们进行了相应的宣传。当然我们也准备了一些药物，包括 我们一线的医生有很多的，应该说比较大的一个比例出现了失眠，我们也对他们进行了及时的一些处理。个别的如果出现了焦虑、抑郁，如果比较严重，也进行了药物的一些治疗。所以总的来说，我们在这一次从开始，我们就特别的关注我们一线的医护人员的心理健康，也采取了相应的一些措施来保障他们的心理健康。
We put a lot of effort to make sure our doctors and people who are involved in this coronavirus to make sure they are safe, and we have psychiatrists for doctors for through telephone and webcam consultation for their symptoms that they can have. And a lot of doctors they have developed by caused by mental stress. They have some symptoms like insomnia, and then some of them are depressed. And then, but for those doctors, we also have the medicine that to help them. Also, like before that they come to work, that we have the doctors. We give them potential, like give them a heads up that what symptoms that they might be experiencing, so they will not be shocked, and they are very well prepared, and they know that what measures or what actions that we have if there's any of the symptoms happening.
Excuse me, sorry, but I have a sound problem, so I didn't listen to the actual question. So could you just repeat it? I'm terribly sorry about that.
Sure. The question is, have the hospitals or your institutions taken any measure to help with the staff, the clinician, regarding the mental health? For example, some of them might be suffering from the PTSD when seeing too many patients dying, or they are overworked and very tired and getting depressed. So any measures your hospital has been taking?
Yes, actually, my colleagues are working for the mental health initiative for the medical staff in Severance Hospital too, and they make a kind of a three-step assessment of the each medical staffs, and that they are really focused on the those who really actually did the medical works for the COVID-19 patients. And we know that they are having sort of the insomnia problems also, and with the PTSD, and especially in Korea, when you're the medical staff in this kind of infectious diseases, you are really easily get traumatized. I mean, you usually get stigmatized. So like people outside general public, if they just meet the doctors or like nurses, if they heard that they are working for a hospital, then they would probably avoid them. And that really mattered in the 2015, the MERS outbreak. Compared to MERS outbreak, now it's better, I think, and in the COVID-19 situation, because we did sort of the campaigns about thanks to the medical staff, the campaign we did. So maybe I think the trauma will get less than that, but like a physical burden about this situation is really high. So in the institution, they get screening measures. So they measure the physical, the medical staff's stress weekly, and then they just get, if they make a high point on that, then they make a meeting one by one to face-to-face meetings and do the consultations and do the monitoring about like that.
Got it. Thank you. So we have Kirsten back. So Kirsten, would you like to ask the next question?
Yes, thank you very much. Hi, Sanjay.
Hi, Kirsten.
Good morning. Well, hello, Dr. Ma, and it's great to see you. Thank you for doing this, and I am so looking forward to coming to China and South Korea whenever I can. I was hoping to come this summer, actually, but we're not allowed to travel right now, so maybe next 2021. But I would love to visit both of you, and it's really so great to see your face, Sanjay. So I have a question about genetic research or biological research. I was wondering if there's any ongoing restrictions on what kinds of samples can be collected, blood versus saliva, etc. And I'm asking because in the US, some institutions are not allowing saliva collections for DNA due to COVID, but others are. And specifically, we use salivary DNA in Africa when we collect DNA. So this is something we're going to deal with. And so wondering what your views or experiences are on this. So opinions, or if there's any experiences either way. Thank you.
So Sanjay, you want to start?
Yes,
first?
I will start. Because Kirsten, yes, I understand about the situation about the making the biosamplings, and this is a really, you know, things we are right now heading, because I am also the PI, the principal investigator of the community health survey, which is done in almost every areas about in Korea annually. But all of the, as far as I know, all of the national surveys has been stopped, and we are unable to do the biosampling. And also, I mean, it's totally stopped to do the questionnaires also by face-to-face. Only the online survey is available right now, and the mental health survey that I did was also in the online. So we just make a phone call and then do the surveys. We are not sure when to open it right now. So for the national point of view, for a large population, it is unavailable right now. But I think if you are in the private sector and there is no kind of a specific limitation from the Ministry of Education or Ministry of Science and Technology. So we have to wait for our government to move.
Thank you, Sanjay. So I'll translate the question for Dr. Ma. So 马老师，那个 Kirsten 的问题是这个如果我们要进行 COVID-19 的研究收样的话，那么医院、政府或者这个伦理在中国有没有一些限制？对于比如说什么样的样本可以收，什么样的研究可以进行？比如说我们这边有的项目不能收血液，有的不能收唾液，在中国有没有这样的这个限制？
这一次在中国的这个研究，中国政府还是要求是非常严格的。首先呢，它收集样本对伦理的要求这一次是特别的高。第二个呢，每一个的研究都要求经过政府的批准。就像我们平时说，我经过伦理的批准以后，那么我研究者我自己发起的研究，在过去是可以的，但是在这一次新冠病毒肺炎过程中间，政府对这一个的要求是非常严，也是要经过一定政府的这种批准。所以说，从目前来说，收集的这个样本我们也能理解，就是因为它可能有传染性等等，害怕担心出现一定的不必要的一些传染。所以说到现在来说，收集样本的单位应该说是不多，只是一些个别的有资质的被政府批准的才收集了样本。这个样本就包括了咽拭子的这个鼻腔咽拭子的样本，以及血液的样本。当然也有个别的也收集了他们的尿液等等等等，但这都是非常少的。
So in China, that the policy currently is very strict, not only on compliance, but also like everything needs to be approved by the government. Personal studies before was easier to be conducted, but now like everything, so like after being approved by the IRB office, and now needs to be submitted to the government for approval. For research, for any like sample collection, no, not that many organizations have the ability or authorization to collect the samples, but the country didn't ban all the research. Some good qualified organization can still do it, but there are only a few.
Great, thank you. Thank you. So considering the time, we're approaching the end of the coffee break. Let's have one last question from Victoria. Victoria, I think you're on mute.
Sorry, I thought I had clicked on mute. Hello, Sanjay. This question is directed to you because you mentioned using a mobile app that was assessing mental health, and I just wondered what questions you were asking and what you had found.
Yes, so I told you about the mobile applications checking about the mental health status, but we wouldn't say it's just the entire mental health status. The easiest thing we could measure was just stress. So it's like perceived stress level, just to by Likert score 1 to 5, and how many stress do you have, and that was the number one. And number two was like, do you had any kind of ideation of suicide? And then those were used because people were not so much familiar with the long questions by mobile. So that's very easy question that we could ask.
Thank you.
Okay.
Thank you, Sanjay. Well, so thanks again for Sanjay and Dr. Ma, your time for joining us and for sharing your thoughts. We applaud all your service and your continued efforts to fight against this virus. Thank you. And we hope everyone is well. And like Kirsten said, we hope this thing will be over very soon so that we can see each other again in Korea, in China, and in US in person. It's great to talk to everyone. Take care.
Thanks everyone for joining today, and stay tuned for more Global Health Coffee Breaks. And we thank our panelists and our facilitators today for a very fruitful discussion. Take care, and we'll see you soon.